So I recently had a really interesting Mohs case. So Mohs is micrographic surgery to help clear tumors of the skin, particularly usually it's basal cell or squamous cell skin cancers. So this particular patient had a squamous cell skin cancer, and just because you necessarily clear on the Mohs slides, which is normally what happens, sometimes that's not always the case. And I think this is where experience comes into play. So I've been doing Mohs for a few years, and what I found is that if I see a really aggressive tumor on the first stage of Mohs, I keep going until it's clear, but then what I do is package everything up and send it off to my pathologist, and then they will special stain it and go through the remainder of the block. I know this gets a little bit technical, but what they do is look at the remainder of the center tissue to see if potentially there is any perineural involvement. Perineural involvement means that the skin cancer has actually started to wrap around nerves, and what happens is that it can actually skip down the nerve. So you may have a clear margin with Mohs, but the skin cancer may have skipped down. Now this is very rare, so this is really more with just aggressive tumors, and you can see that morphology on the slides when you're looking at it, and you kind of have maybe a guess or a hunch that this is really an aggressive tumor. I should have my pathologist actually immunostain specifically to look at the nerves. So one thing to think about.